Hello, good morning, everyone. This is Sandy Marrero with Western Marketing. Happy AEP to everyone. I hope that everything is working fine for everyone. I have today Letty Perez, broker account executive with Pivot Health. We're going to be talking about a very exciting product, which is a bridge to Medicare for those people who are getting into Medicare but are having they have a spouse that is still not of age of Medicare. This is a great product for those. And also, we were going to be talking about the short-term medical product as well and any other ancillary product. Again, Sandy Marrero with Western Marketing. And without further ado, we introduce you to Letty Perez, account executive from Pivot Health. Letty?
Yes. Good morning, everyone. Thank you for joining. As Sandy said, my name is Letty Perez. I'm the broker account executive. I work with Western Marketing, and I'm here to present the product portfolio that Pivot Health has to offer so that you can find solutions for all of your clients' needs. I would like to just mention that if you have any questions, please feel free to enter them in the chat box as Sandy is going to run through the questions at the end of the presentation so that I don't keep you on any longer than you need to be. I know this is a very busy time of year with the open enrollments. I know the Medicare open enrollment has started and open enrollment for ACA will be coming up upon us here in the next 2 weeks. So with no further delay, I'm going to start out by explaining to you a little bit about Pivot Health for those of you that are new and just getting recently contracted with Pivot Health. I want you to understand Pivot Health is not an insurance company. Pivot Health is a product development, marketing, and management company. So we actually create the products and then we take it to a carrier to put it on their paper. Our team is made up of marketers and risk managers, product developers that have many years of experience and have managed billions of dollars of insurance premium over their careers. In 2018, Pivot Health was acquired by healthcare.com. We're very excited about that because we have a strong backing. Healthcare.com was ranked 583 on the 2019 INC fastest growing private company. And just to give you an idea how quickly we have grown, our first full operating quarter, it was in 2016, was the fourth quarter, and we sold 1,000 applications. Last year, we ended the year with over 40,000 applications. This is just to give you a visual so that you understand in case you see other names appear when you're working with Pivot Health. Again, Pivot Health is the product development, marketing, and management company. We have insurance benefit administrators. They are formally known as Allied National. So you may see communication coming in from the client services area that will say insurance benefit administrators. For some things, you will access the Allied National portal. That's one and the same company. They are our TPA. So they manage our plans and they also handle our commissions. Then we have our insurance carriers. As I mentioned, we are not the insurance carrier. We partner with insurance companies to underwrite our products. Then we have the network and PBM's relationships that offer benefits to our clients. So the Pivot Health is really our under 65 age product suite. And I'm going to mention the different categories of products that you have to offer your clients because you will see these products available on your quoting tab. We have our short-term medical, which is our niche products. We do offer fixed indemnity plans, which are zero deductible, first dollar benefit plans. Then we have our dental and vision plans to offer, as well as a supplemental plan. And our supplemental plan pairs up great with short-term plans for out-of-pocket expenses, and that is our only guaranteed issue plan. So I'm going to concentrate on the short-term products, because these are our niche products, and these are the plans that you're going to be able to offer to your clients, especially for that over 60 age. And that's especially now during Medicare open enrollment. As Sandy mentioned, you're going to have probably a lot of clients that are getting ready, or you're enrolling them for their Medicare, and they may have a spouse that's not yet ready or not old enough to qualify. So you're going to need options for that other person. So the Pivot Health STM, what makes it unique? We've got such a large array of plan options to fit all of your clients' needs and budgets, and you'll see that as I go through each of the products. Each one has a little unique feature to it. The coverage for our plans is available within 24 hours from the date that you're actually quoting and enrolling the client. So they can have an effective date as early as tomorrow. And you can also bind their coverage as early as 60 days out. Extended duration options allow your clients to have, in some cases, up to two 12-month policies, or 2 by 364 days. We have access to some of the largest national networks on our plans that have PPO networks tied to them. We also have plans with open access, which means there's no network restriction, no PPO network that they have to stay in. So they have a freedom of choice of use as far as providers and facilities. With those plans, we use our reference-based pricing to help provide the client with the discounts on their out-of-pocket expenses. And I'll be going over the reference-based pricing here in a little bit. Eligibility ages for all of our short-term plans start as young as 6 months of age all the way through 64 years and 11 months. So that means that they have the plans available till the last day of the month prior to their 65th birthday. So right before they turn eligible for Medicare. We have child or children only policies from as young as 6 months of age. Our plans cover high school and college athletes, and our short-term plans are all underwritten, backed by A-rated carriers. I mentioned the extended durations. So the duration options are going to be 4 by 90 days, 2 by 180 days, 2 by 364 days. Now, this is going to vary by state. You don't have to memorize where you'll be able to offer that. We do have a chart that I'll show you in your back office, in your agent portal. But when you go to run a quote, and you enter the zip code, the system will automatically only display durations that are available to that in that area. There's no new application in between the coverage periods. So when the first policy ends, the next one starts automatically. They have no gap in coverage, no new underwriting, no new waiting periods applied to subsequent policies. Copays and coverage maximums do start over with each new policy. Deductibles, coinsurance maximums also start over, and this extended duration option must be selected at the time of enrollment. So keep in mind that with these short-term plans, clients have to be able to qualify by answering all the medical history questions on the application to be eligible. With doing an extended duration, they don't have to worry if a condition develops while they're on their first coverage period. That condition would still be covered in the subsequent policy because they were already on the plan. So it minimizes the risk of them not being eligible in the future. This is the chart that I mentioned. This is in your agent portal. Under your agent resource tab, you'll also have a product availability if you want to see which plans you have available to offer a client, for those of you who sell in more than one state. As you see, the duration availabilities do vary by state. There are some states that have limitations on how long the coverage can be in force, and some states actually limit how many short-term policies an insured can have. So here's our portfolio of short-term plans. Then keep in mind, all of our plans are designed that they can be offered to from a child all the way to 64 and 11 months of age. So we have our core plans that are a PPO plan. Our classic plans are actually our open access plans, and there's going to be 4 plan designs under that category. We have the newest short-term plan that rolled out in the last 6 months, called our Epic plans. Then we have our Quantum plans, which is a Cigna PPO plan, very rich in benefits. And then we have our Bridge to Medicare plan. And this is the short-term plan designed specifically for those from 60 to 64 and 11 months of age waiting to get onto that Medicare. I'm going to start out with reviewing some of the features of the Epic plans. With the Epic plans, you're going to have 2 plans to choose from. It's either going to be the Epic PPO or the Epic base plan. This is actually a screenshot of the brochure. That middle column that you're seeing on the screen, that is simply showing you if they are on an Epic PPO plan and they go out of the Cigna network, how the benefits would vary. Of course, if they select to be on an Epic PPO plan, they do want to stay within the network because that's where they're going to have the highest savings on their out-of-pocket expenses. Keep in mind that the Epic PPO plans are 100% coinsurance. So once they meet their deductible, the plan will kick in. They have 2 total coverage maximum options, either $500,000 or $1 million. These plans do offer unlimited and free telemedicine benefits. So keep in mind, there are no office visit copays on these plans, but they do have access to telemedicine, and there's no limit how many times they can use it, and it is free to each covered person per coverage period. The plan does include a preventive examination benefit. So after a 3-month wait or a 90-day wait from when the plan goes in force, all insureds have access to 1 preventive examination, and the plan will cover up to $100 for that visit. Some of the other benefits on these plans offers a supplemental accident plan. Now, keep in mind that this is not included in the plan. It's an optional benefit. It's a rider that needs to be selected when they are enrolling in the coverage. Essentially, what the supplemental accident offers is if the insured gets injured in a covered accident while on the plan, and they require medical attention within 72 hours of the accident, they would have coverage up to, depending on which benefit they select. If they selected the $5,000 benefit, it would pay up to $5,000 of the medical expenses incurred due to that accident. Okay. And keep in mind, if they don't select it at the time that they're signing up, they will not be able to go back and add it on afterwards. The Epic PPO plan offers coverage if the insured is traveling outside of the United States. Most short-term plans will only work within the US. These plans, if they require immediate medical attention, they will have coverage. It will be treated as an out-of-network and subject to deductible and coinsurance, of course. With the Epic plans, you also have an option to select a plan that will include prescription benefits. Again, it is an option. It doesn't come with all the plans. You have to make sure that they select the plan that includes the prescription benefits. They utilize the Cigna PBM. There is no prescription deductible that needs to be met before the copays kick in. So that's a very important feature. And the copays start as low as $5 for generics. Keep in mind, for the Epic PPO plan, it's going to utilize the Cigna PPO network. The brochure has a live link in it where you can actually click and look up a provider in that network. The Epic base plan is an open access plan. It will not use the Cigna PPO network. Now, if they select the Epic Base with the prescription, it does use the Cigna PBM, but it will not use the provider network. So just to kind of recap some of the key features of the Epic plans. So you have 100% coinsurance plans available. You've got plans with the $5,000 out-of-pocket maximum available, free and unlimited telemedicine benefit. And with the way things have been around the world, over the last 9 months, you see that the telemedicine is actually something that's going to be more utilized in the future. The Epic PPO plan, again, uses the Cigna PPO network. And for the prescription benefits, if they select that option, it'll use the Cigna PBM. The Epic Base utilizes reference-based pricing for open access and premium savings. Again, the Epic Base plan does not have a PPO network tied to it. So they can use any doctor, any facility, and we will use the reference-based pricing. The optional prescription copay drug card with no deductibles. And the prescription benefits, if they select that option, includes contraceptives. Most of our plans do not when you have prescription benefits. The Epic plans also offer preventive wellness coverage for the whole family, including prostate and colon cancer screening, mammograms, and OBG annual exams. And these benefits are subject to deductible and coinsurance. Childhood immunizations are paid at 100% on the Epic plans. And we are finding this is our newest plan on the market. It's less than 6 months old, and we're finding that the majority of the clients that are signing up on the Epic plans are families. The optional supplemental accident plan that I explained, they've got either a $5,000 or a $10,000 benefit to pick from. Coverage when traveling in a foreign country with the Epic PPO plan. And keep in mind, the insurer of the Epic plans is North River Insurance Company. They are an affiliate of Crum & Forster, and they are an A-rated carrier by AM Best. Okay, and you don't have to memorize any of this. This is all on your client's ID card. Epic plans do have waiting periods, as do all of our short-term plans. So with the Epic plans, to use the plan for a sickness, it's going to be a 3-day waiting period. For a cancer diagnosis, it's going to be a 30-day waiting period after the plan goes in force. And for that preventive exam, as I mentioned earlier, it's a 90-day wait or a 3-month waiting period. For our other plans, the 30-day wait for cancer is across the board. Some of our plans will have a 5-day waiting period for use for sickness. Just make sure you refer to the details on each plan when you're quoting and enrolling a client. Then we have our core plans. As I mentioned, the core plans is a PPO plan, but it's a passive PPO plan. What does that mean? If the client decides to go out of the First Health Network, which is the PPO network that's utilized for the core plans, they will have benefits, and we will again use the reference-based pricing to help reduce the out-of-pocket expense. The main difference on these two plans is going to be the deductible amount. It's obviously Core 1000 has the $1,000 deductible. Core 2000 is $2,000 deductible. Both are an 80-20 plan, so they are responsible for the next after deductible for the next 20% of expenses till they spend another $1,000. So keep in mind that the max out of pocket is a total of the deductible and the coinsurance max out of pocket. Coverage maximum on these plans is $750,000. Another difference is going to be the prescription benefit. On the Core 1000, it's going to be a discount program only. On the Core 2000, it's an insurance. They do get generics at $10, and after that, they do have to meet a $500 deductible for the other copays to kick in. The core plans offer office visit copays, $30 for a primary doctor and $60 for either an urgent care or a specialty. Keep in mind that the office visit copays are limited to 3 visits per insured per coverage period. And when I say 3 visits, that's a combined 3 visits. So if they go to a primary doctor once and they go to an urgent care twice while during that coverage period, they've then utilized their 3 visits. Now, do take note that on the core plans, the hospitalization benefits are fixed. And when I say fixed, what do I mean by that? The plan maxes out. For example, if they are confined to a hospital, regardless of deductible and coinsurance, the plan is only going to pay up to $1,000 per day. So, and that includes room and board and any miscellaneous charges. So you may want to make sure that your client understands, if they opt to go on a core plan, that if they have to use any of the hospitalization benefits, they may be exposed to some additional out-of-pocket expense. So some of the key features of our core plans: PPO plan, utilizing the First Health Network. It's a very large network across the country. The plans do offer the low deductibles. The coinsurance max out of pocket, again, does not include the deductible. So the coinsurance max out of pocket has to be added to the deductible. I mentioned the fixed hospitalization benefits. Both plans offer the doctor office visit copays. The prescription drug benefit will vary depending on which plan they select, whether it's going to be a discount program or an insurance. And our core plans are underwritten by Companion Life Insurance Company. Companion Life has been in business for over 40 years, and they are an A-rated carrier as well. So again, if they have a core plan, their carrier is going to be Companion Life, and again, that will be on their ID card. Then we have our classic plans. Classic plans is just actually a category that we put our open access plans under. So the plan names are really going to be your Choice, Economy, Deluxe, and Standard. These are the plans that are going to give you the largest amount of plan options when you're in your quoting portal. So you want to get familiar with which plans you would feel would best suit your client based on what they're looking for. You're going to have plan choices with deductibles starting as low as $1,000 all the way up to $10,000, depending on which plan you select. You have 2 plans that offer office visit copays, the Choice Plan and the Deluxe Plan. Again, it's a $30 copay for a primary, $60 for a specialist or an urgent care. And again, just like with the core plans, the doctor visit copays are 3 per insured per coverage period combined. Then you have 2 plans that are going to offer a discount program for prescriptions, your Choice and your Economy. Your Deluxe and your Standard are going to offer an insurance. The Deluxe being the richest in that the generics are $10, and then they have to meet the $500 deductible for the preferred and non-preferred copays to kick in. And then you have your maximum coverage on these plans range from as low as $100,000 all the way up to $1 million. So you see where the combination, there are so many plan options. You do want to become a little bit more familiar with these plans so that you can narrow down the plan options. So the classic plans. Again, it's the largest array of plan option choices, whether it's prescription coverage to be included, doctor office visit copays, your maximum coverages from as low as 100,000 all the way up to $1 million. Keep in mind that our maximum coverage dollar amounts are per coverage period, not lifetime. Some companies, the short-term plans are a lifetime. So if you do an extended duration and they have 2 364-day policies back to back, and you selected the $1 million maximum coverage, they get that $1 million restarts for the next policy coverage period. The coinsurance max out of pockets on these plans, again, do not include the deductible. So you want to make sure they understand it's the deductible plus the coinsurance max out of pocket for their out of pocket expense. The classic plans have no network restrictions. Again, there's no PPO networks that they have to stay within. They have freedom of choice. And again, we use balance bill protection with our reference-based pricing. The insurer of the classic plans, the economy, choice, deluxe, and standard, again, is Companion Life. They are, again, an A-rated company. I keep referring to our reference-based pricing. So what does reference-based pricing mean? Pivot actually will pay up to 125% of Medicare allowable for a physician and up to 150% of Medicare allowable for a medical facility. Now, keep in mind, your client doesn't have to do anything special. This is not something that they have to remember. This is all between the provider and Pivot Health or insurance benefit administrators. The client goes to the doctor. They present their card. The provider will take down the claim information. So the provider will then submit the claim to insurance benefit administrator for processing, and the claims are going to be repriced according to the percentage of the Medicare allowable. The payment is going to be then made to the provider. The average discount that the client receives on using reference-based pricing is 68%. So it's a very, very steep discount. The member receives an EOB or an explanation of benefits, which will show the discount amount. Balance bill protection. The member will not be responsible for a balance bill due to the discount. So if the insured happens to get a balance bill from that provider or that facility, they can submit that to insurance benefit administrators. We actually have a team that will go back and renegotiate with the provider or the facility. And if they cannot come to an agreement on a dollar amount, insurance benefit administrators or Pivot will pay that balance bill on behalf of the client. So that's a real safety feature for our insureds. Here's a simple example of how this reference-based pricing would work. So this example is showing a 59-year-old in Nebraska that required an MRI. The charge was $1,060 for that procedure. The Medicare allowable amount for that procedure in this area was $222.72. We recalculated it with an extra 25%. So it comes out to $278.40. If the deductible had been met for this client and they were only meeting their coinsurance max out of pocket, they would have been responsible for 20% of that $278.40 being $55.69. If the deductible had not yet been met by the insured, they would have been responsible for the $278.40. But just to give you an idea what a steep discount that is, from a difference from $1,060 at the worst case scenario for that insured would have been $278.40. That's a substantial savings. Then we have our quantum plans. Our quantum plans, there's going to be two plan designs to select from. You're going to have the quantum PPO high deductible plan or the quantum PPO copay plan. The third column, in this is again a screenshot of the brochure, is just showing how the benefits would change if they went out of network. Both plans, both the high deductible and the PPO copay plan, utilize the Cigna network. These plans do offer some wellness, preventive health. So you have one visit per insured per coverage period, and it'll cover up to $250 for that preventive health visit. It also includes some wellness benefits such as routine annual OBG exams, and those would be subject to deductible and coinsurance. On the quantum PPO copay plan, they will get office visit copays. So you have the $30 for the primary and $60 for the urgent care or a specialty. And again, it's a total of 3 visits per coverage period per insured. The Quantum PPO copay plan also offers prescription benefits. No deductible to be met, and the copays kick in. So $5 for generic. So very rich in benefits. It uses the Cigna PBM for the prescription benefits on the PPO copay plan. On the high deductible, it would be a discount program only. 2 other key features on the quantum plans that you want to take note. The quantum plans, like the Epic PPO plan, Epic PPO plan, does offer coverage if the insured is traveling outside of the United States and requires immediate medical attention. With the quantum plan, you have a supplemental accident benefit included. This is not a rider that has to be selected. It comes automatically with the plan. So essentially how it works, if the insured gets injured in an accident while on the plan and requires medical attention within 72 hours of the accident, the plan will cover up to 100% of the insured's deductible. So that's pretty substantial. Say they have a medical expenses that total $6,000 and their deductible on the plan was $5,000. So they've got that first $5,000 covered by the plan. So quite a rich benefit. So a recap of our quantum plans. They utilize the Cigna PPO network, Cigna PBM for the prescription benefits. It does include that preventive health benefit. We use reference-based pricing if they do go out of network with that balance bill protection that I explained earlier. The out-of-pocket maximum does include the deductible on the quantum plan. So keep in mind that is different than the classic plans and the core plans. Doctor office visit copays are available on the quantum PPO copay plan. The quantum plans do offer coverage for organ and tissue transplants. There is coverage when traveling outside of the United States on either of the quantum plans. And our quantum plans, again, are covered by Companion Life Insurance Company. So please don't get confused. We use the Cigna PPO network. That's just an agreement that we have. We are not affiliated with Cigna. The insurer of the plan is Companion Life Insurance Company. We're very excited. We recently rolled out our mobile app for your insured, which makes it very easy for the member to have access to their ID cards and documents. When they enroll, they get an email with instructions how to enter into their member portal to download their ID cards. Keep in mind, everything is electronic, so they're not going to get anything in the mail. They can download their ID cards and their policy documents, and now they'll have instructions how to download the mobile app so that they can have their ID card with them at all times. So our 60+ strategy. So we mentioned, I've mentioned that these plans are available from the age of 6 months all the way up to 64 and 11 months of age. But our key product, our Bridge to Medicare. So the Bridge to Medicare obviously is not available to children. They have to be a minimum of 60 years of age in order to offer it where it's available. And this was a plan designed by Pivot Health because they realized what a important market this is and how much this is needed. So we've got today over 12 million of the 77 million baby boomers born between 1954 and 1972 in the US are between the ages of 61 and a half and 64 and a half. That's about 28% of the population. We've got over 10,000 people turning 65 every day, and this is going to continue into 2030. About 45% of these baby boomers consider themselves to be entrepreneurs. So what does that mean? These are self-employed people that don't have access to group or employer benefits. They're on their own to get health coverage. About 50% of this population over the age of 60 have incomes that make them ineligible for an ACA subsidy. And for those of you who work the ACA market, you realize how expensive for those over 60 the ACA plans can be if they don't have a subsidy. In 2019, we had about 9% of our members enrolled in the short-term plans were over the age of 60. So far, and these numbers are actually higher today, we have over 16% of our members in 2020 over the age of 60. So this population is growing. And it's as they get closer to the Medicare age, it does get more challenging for them. So the bridge to Medicare plan, it's a short-term plan, but we've made 3 plans choices for you. So unlike the other plans that have a lot of different deductible options and different variables, when you quote a bridge to Medicare plan for a client, they're going to have 3 plan options. They're already prepackaged. They automatically get 3 by 364-day plans. So like an extended duration that I went over earlier, difference is they don't have to select that option. When they enroll in a bridge to Medicare plan, they automatically get the 3 plan, 3 times 364-day plans automatically. So they get the same benefits as if you select an extended duration. So they are going to qualify on the onset when they submit the application. They don't have to do a new application in between each coverage period. They don't have to worry about new lookbacks. They don't have to worry about new waiting periods. And keep in mind, if something should develop during their first or their second coverage period, that condition is going to be covered in that subsequent policy because they are not doing a new application. They also get included with in the Bridge to Medicare association benefits through Communicating for America. What does that mean? They have access to telemedicine. And if they use the telemedicine benefit, it costs $49 to use the consultation. They can submit that receipt once they've paid for it. They can submit that to Pivot or insurance benefit administrators, and we will refund them that $49. We'll do a reimbursement. So essentially, that telemedicine benefit is going to cost them nothing. Especially important nowadays with the way things are going and clients being leery about going out and going into a doctor's office. This is a great benefit, and it's going to cost them nothing. The plans include RX benefits automatically. The premiums on these plans are going to be so affordable when you compare it to a ACA plan for an over 60-year-old person. And keep in mind that these benefits for these clients, especially, they're going to be healthy people that don't use plans. Obviously, if they have pre-existing conditions, they're not going to be eligible for these plans. So for you have a healthy person, for them to spend a high dollar amount on premiums on an ACA plan, this is a great alternative. Let them keep the money in their own pocket until they need it. The Bridge to Medicare plans are open access, no PPO networks. What does that mean to the client? You've got a 60-year-old, a 61-year-old, 62-year-old that is already comfortable with a doctor, whether they just go once a year or if they go when they need it. They don't have to change doctors because of their health insurance plan. So a lot of features for these plans. Now, keep in mind, a 60-year-old can apply for this plan. They will get 3 by 364-day plans. So what will happen at the end of those 3 terms, they would have to reapply at that point. Now, if you have a 63-year-old and they enroll, they are obviously not going to ride out the 3 terms because the plan will automatically end when they turn 64 and 11 months. So it'll end the last day of that month prior to their 65th birthday. Okay. Now keep in mind, if the plan is not available, or the client is looking for something, different benefits that are not offered by the Bridge to Medicare, they are still eligible for any of the short-term plans. And if they're in a state where they can extend the duration, they can get possibly up to 2 by 364. So we highly recommend, where available, if you have a client over the age of 60 or turning 60 and they're looking for coverage, this is you'd want to start with this plan. It's the most beneficial for that age band, but they do have other options as well. So the Bridge to Medicare plan benefits issues up to 3 by 364-day plans. You have the added association benefits, which includes the free telemedicine because we will reimburse them. There's no network restrictions. They have no gap in coverage, no new underwriting, no new waiting periods applied to the subsequent policies, no new pre-X look back for the next policy. Their deductibles, coinsurance maximums do start over. Their coverage maximums, again, start over with each policy. And the insurer of the Bridge to Medicare plans is Companion Life as well. Again, an A-rated carrier. This sheet, this is something that we created recently. It's a little cheat sheet. You'll find this in your quoting platform. It's also available in your agent resource tab. So what it is we've taken different type of scenarios that of your potential clients, so that it can help you start in the right direction as to which plans would best suit this client. So just a little cheat sheet, and I thought I'd share it so that you can take a look at it. It is helpful. Our ancillary products. We have a standalone or add-on dental plan called Brilliant Dental. Our dental plan is underwritten by Renaissance Dental. The plan is a PPO plan. The eligibility ages for the dental plan is 18, and there is no maximum age. So if the client turns 105 and wants to keep the coverage, they can do so long as they continue paying their premium. Keep in mind that with our short-term plans, because you can add dependents onto the plans, if the child is under the age of 18 and there are a dependent on a plan, they do have benefits. It's just you cannot sell it to a child only. The dental plans come with the option to add on a vision coverage as well. You cannot purchase the vision without the dental. There are no waiting periods for the benefits on these plans. You can do it as an add-on to a short term, including our Bridge to Medicare. And if you do so, the start date for the dental coverage is going to coincide with whatever effective date you selected for the short-term plan. The plans are progressive plans, so some of the benefits and the annual maximums will increase at the beginning of the first 3 coverage periods. Keep in mind, this is an insurance. This is not a dental discount program. Routine cleanings are paid at 100%. You have basic and major services, including fillings, extractions, crowns, and implants coverage. And then the vision portion, if they select to add the vision on as well, it is through Vision Care, and it is a PPO plan. And there's only going to be one plan option to add on. And keep in mind, you do have a dental tab on your quoting portal if you're just looking to sell a dental plan. Then we have our supplemental plan. Our supplemental plan is actually a bundled package of accident, critical illness, accident, death, and dismemberment, and hospital indemnity in one. It's the only guaranteed issue plan that we offer. And again, you'll find it under the supplemental tab on your quoting platform. We used to sell it as standalone only, and then we did add it to our check the box in the shopping cart when buying a short-term plan where it's available. And the sales increased dramatically. A lot of times agents forget to offer it. This is a great way to help your client with out-of-pocket expenses while on a short-term plan meeting deductibles and coinsurance. Keep in mind that the Latitude plan, even if you sell it as an add-on, it is a separate plan for from the short term or the bridge to Medicare, and it can stay on the books until the client reaches 64 and 11 months of age. So even when the short term ends, they can keep this supplemental plan up until that month before they are Medicare eligible. The cash benefits on these plans are paid directly to the insured. So this is what we're saying, it helps with their out-of-pocket expenses. And keep in mind, we are going to be adding some new benefits to the Latitude plans. So if you see any communication once you're contracted with Pivot from Pivot Health, you'll want to pay attention to the emails. We try to share any updates and changes to our plans and any new benefits that we add on. Once you're contracted to sell Pivot Health, you're going to get a welcome email with your agent ID number. You're going to go to pivothealth.com and you're going to go to My Account, Agent Login, and you're going to register to get into your portal. Once you're in, this is what your homepage is going to look like. If you've already sold business, you have the tab to go into your book of business. In your book of business, you have access to your clients' policies, their ID cards, their documents. You'll have all their information in your back office. Then if you want to run a quote, you click on the Get a Quote and you get started. In this example, I'm going to share with you, this is for a short-term plan. If you are looking to sell a Latitude plan, you would go to the supplemental tab. We have our limited benefit plans, which are zero deductible. You have our bridge to Medicare plans. We have dental and vision, and we also do offer a Medicare supplement. Now, keep in mind, when you're in the short-term quoting platform, and as soon as you enter a date of birth and the system realizes that that client is 60 or older, and if it's available, it's going to give you a pop-up and it's going to remind you to offer the bridge to Medicare plan. In this example, we've put in a Florida zip code, and then you click See Our Plans. It'll automatically populate the zip code on the next page. On this page, you're going to enter the date of birth of the insured. You're going to enter the gender and the first name. You do not need to enter an email address on this page. Obviously, you're going to add spouse and children if that's what you're looking to quote. And then when it comes to your desired start date, the system is always going to default to the earliest effective date, which would be the next day. If the client doesn't need coverage to begin immediately or the next day, you have the option of going to this little calendar to the right. That will open up and allow you to quote and enroll a client as far out as 60 days from the day that you're running the quote. Now, keep in mind, you want to make sure that your client understands that as soon as you submit a policy, the application, whether the effective date is tomorrow or 60 days out, their initial premium for their first 30 days of coverage is going to be drafted immediately. So you want to make sure that they understand that. If once their policy is submitted and their initial draft is taken, their monthly drafts are going to happen based on their effective date. It doesn't coincide with the effective date. So if their effective date falls between the first day and the 19th of each of the month, their draft date is going to fall on the 10th of each month. If their effective date falls between the 20th and the very last day of the month, their draft date is going to happen on the 22nd of each month. And at this time, we don't have the capability of making changes to when their draft will happen. It's done automatically by the system. Then you have your duration options. The system will always default to the longest duration. If you're looking for a 6-month policy or anything under that, because you can sell as little as 30 days, you would want to click on the 180-day option to narrow it down and make it less than 6 months. So this example is going to be on 364 days. We're going to click Find Plans, and that's going to take you to the next screen. This is where you're going to see the probably between 40 and 50 different plan options, depending on the state that you're quoting in. I highly suggest you get comfortable with the filters on the left-hand side of the screen. This example, we've narrowed it down and we've selected Epic. And once we hit Epic, automatically all the other plans go away, and you would only see the Epic plans available in that area. If you would like to send a client plan options, you can select up to 3 different plans by clicking on those compare boxes in the top right-hand corner of each plan you want to select for them. And then you go to the compare 3 plans button at the top, and you would then come to this screen. It's going to have the 3 plans that you selected side by side so they can do a comparison. And then you have the option of emailing this over to a client. Keep in mind that your system is not going to store the quotes that you selected, but when you email it to the client, and when you click on email this quote, it opens up a window where that's where you would populate your client's email address and their information. So your system will automatically send you a copy of that email. The contents of the email is static so that they can click on view more details, view a brochure, or actually start the application process right from their email. If you click view details on one specific plan, this is going to be the page where we're going to be able to extend the duration and add supplemental products to it. Please take note, this example is they selected a Epic PPO plan, including the RX coverage. And this is the indicator that you've selected a plan that's going to include the prescription coverage when it comes to the Epic plan. If the client wants to go with the extended duration, you would click on the button where it offers the extended duration. In this example, we're looking at an Epic PPO plan. So this is where you would have to select that supplemental accident rider, and it tells you exactly what it's going to cost by adding that plan on. This is also the same page where you're going to have the option to add on the dental and vision if they're interested. And there are 2 plan options, a dental low and a dental high. And then you have the accident and critical illness that you can add on. That's the latitude plan that I went over. As soon as we were live on the site right now, as soon as I would click on any of those options, the summary here on the right side would update automatically. So this is what it would look like once I clicked each of those options. So it changed the number of days of coverage, went from 364 to 728. It changed the premium, and you still have the option to email the quote to the client at this point. If you did this, this is what the email would look like. It's going to show them the extended duration. It's going to show all the supplemental products that you added on to it for them. And they can, again, from the email, they can start the application, they can view brochures. And again, even if you sent them the one specific policy to look at, you will have a copy of that in your inbox. Keep in mind that the short-term plans and a bridge to Medicare is included. These are simplified underwriting, so there's not going to be any additional underwriting done once the application is submitted. They have to be able to answer no to all the questions on the application. Keep in mind that we do not ask a tobacco question. We don't have a height limit. There is a weight limit, 250 pounds for a female, 300 for a male. We do accept type 2 non-insulin dependence. So that's not a knockout for us. We do accept type 2 non-insulin dependence. We also do not ask for a social security number. So the client would have to be able to answer, if they are not a US citizen, that they have resided within the United States for the prior 12 months. Once they answer all the questions, if they click yes to any of the application questions, the system will stop and let them know that they're not eligible for coverage. So you don't have to worry about drafting, processing an application and drafting their account when they're not eligible. They have to be able to get through the application questions in order to qualify. Once they get to this page, this is where they're going to enter their payment information and their personal information. The payment options are going to be a credit card or an ACH. There is no paper billing option. And even at this point on the application process, they still have an option to change the duration time. They open up the calendar and they can change when they want the plan to end if they realize they don't need it for the full term that was originally selected. If you do that, you need to make sure that they click on the little save button here, because if not, it will revert back to what was originally selected. Keep in mind that these applications are all electronic. So once they read through all the disclosures, all they have to do is click to sign, and the application will be processed. They will get an email confirming that they've purchased the short-term plan, and including their information and instructions on how to get to their policy documents and ID cards. You as the agent will receive an email confirmation as well. I mentioned the association benefits. Most of the states where our short-term plans, including the Bridge to Medicare, are filed through the Association Communicating for America. That's how we have access to our doctor on demand. So for the regular short-term plans, it's a $49 fee. It would be an out-of-pocket expense. It does not get credited towards the deductible. For the Epic plans, they're going to have unlimited and free telemedicine. For the Bridge to Medicare, if they use that benefit, they can send in the receipt and we will reimburse them. In the association benefits, they also get some discounts on prescription drugs as well as vision and audiology. Our fixed indemnity plan. These are our no deductible or coinsurance plans. They're first dollar benefits. So these are plans that will pay fixed dollar amounts up to certain limitations based on which plan they select. Keep in mind, these are not guaranteed issue plans. They do have to go through the application process, but some of the benefits include, for example, a daily inpatient benefit, depending on which plan they select, up to $3,000 for a sickness, $6,000 for an injury, a day for 365 days a calendar year. ICU benefits, again, $6,000, up to $6,000 for a sickness, up to $12,000 for an injury, a day for up to 30 days. You've got a $5,000 or a $10,000 critical illness coverage for invasive cancer, stroke, heart attack, and stage kidney failure. You also have an accidental death benefit of $10,000 and $20,000 common carrier life benefits are included. And depending which policy is selected, they can get a reimbursement of up to $125 one time a year for a wellness visit. There's additional benefits for fractures, dislocations, burns, and other conditions as well. And we have recently simplified the verification process. So now you can call in with your client on the phone with a script that's provided to you at the end of the application, so that you can run through the questions, and it takes less than 5 minutes to have the plan verified and put in force. Again, keep in mind, these plans are not guaranteed issue, and these plans will automatically renew each year until the client turns 64 and 11 months of age. So there's not a limit on how long they can keep these fixed benefits. Pre-existing conditions. Want to make sure that all of you are comfortable and familiar with the limitations on the plans. Pre-existing limitations prevent coverage from applying to medical conditions that exist prior to the effective date of the plan. And pre-existing conditions are, what does that mean? It's expenses, including medical charges resulting directly or indirectly from conditions for which a covered person received medical treatment, diagnosis, care, or advice within the prior 60 months. So it's a 5-year look back. So you want to make sure that the clients understand that these plans do not cover pre-existing conditions. These are not ACA plans. Just wanted to share with you that we do have a bonus program going on now through December 31st. I know during open enrollment and Medicare open enrollment, this will be a very easy to obtain goal. If you need the flyer, feel free to reach out to either Sandy or myself, and I'll be happy to get this over to you. I did mention that on our quoting platform, there's a Medicare supplement tab. If you're interested in selling these plans, feel free to reach out to Sandy. He can get you set up to sell the Medicare supplements that we offer through Pan American. And now I'm going to open it up to any questions. And here's my contact information. Sandy?
Yes, thank you very much, Letty. I appreciate it. It was a great presentation. I'm thinking that there's quite a bit of great product that most of the agents can use on the suite of portfolio that you guys have.
Thank you.
So very good presentation. I am going to check on the questions and see which questions we have, and then we're gonna close it out, so people can go back to the normal life and trying to go back to the AEP
Sure,
section
absolutely.
of their life. So let me see which questions I have here, and I'm going to give it a moment. The questions, one of the questions that they had was, if a person purchased a 12-month policy and then he have a cancer on the 6th or 7th month of the policy, when it comes to renew the policy, what would happen?
So these plans they're not renewable. The applicant, if they did not have an extended duration and they just did a straight 364, unfortunately, they would not qualify to reapply because they would not be able to answer the medical history question on the application. That would exclude them because they had cancer within the last 5 years. So that's where the extended duration really comes into play. Say that scenario happened and they had a 2x364 plan and they had a cancer diagnosis 6 months into the first coverage period, they're automatically enrolled for the next coverage period, and that cancer would still be a covered condition.
Great. And that is to the extent of the questions that I have right now. Going to let you guys go. I thank you very much, Letty, for your wonderful presentation. And then if anyone has any questions, I have sent an email to every individual on the webinar to get contracted if you're not contracted, with information on the plans as well. If you have further questions, don't hesitate to give me a call or send me an email, and I'm gonna be answering any questions you have. I'm gonna try to see if I can get a copy of the presentation as a PDF version of it. If you are able to send me a copy of that, Letty, I will really appreciate
I sure can. Absolutely.
and then I will send a copy of the webinar to you. So thank you very much, and then I hope that you have a wonderful day, everybody. Okay.
Thank you, everyone. Look forward to working with you.
Have a good one.
Bye-bye.